Hello everyone, my name is Dr. Ziaur Rahman. I'm an orthopedic surgeon working at Yashoda Hospitals, Malakpet. Today we'll talk about hip joint pains and hip related problems. We'll talk about what is hip joint. Basically, hip joint is a kind of an ball and socket kind of a joint where you have a ball kind of a center which moves in a socket. One ball moving in a kind of a cup. This hip joint is a quite vital joint in our body. It's one of the biggest joint in the body, which bears our weight whenever we are walking, running, standing, sitting, climbing stairs. These activities are helped by our hip joint. So usually what happens is like people do experience kind of pain in the hip joint whenever they are walking for long durations. Probably they're having difficulty in sitting up in squatting or sitting crossed leg. If they find difficulty, if they find kind of a nagging pain when they were trying to walk for a short distance of a while. Even if you have pain when you try to climb a stairs or move your leg in a particular position, then these are signs of hip joint problems. So it's always better to address these kind of pains and problems. Whenever you have these kind of pains and issues, it's always better to seek an orthopedic advice and get basic investigations done. So what could be the problem when you have hip joint pain? Usually there are multiple problems which can arise in the hip joint without any injury. So for example, if you have an injury, if you have a fall, probably it could be related to a small kind of an undisplaced fracture. There could be a small bony avulsion. There could be a kind of a labral injury. The labrum is a part which covers your joint on the outer aspect. There could be a labral injury which will be kind of giving a nagging pain. Third thing is like there could be a swelling in the joint which could lead to pain whenever you're standing or walking and you're doing your normal routine activities. These kind of things can be also related to chronic infections. If there is a chronic infection in the joint, which might be again causing repeated swelling in the joint and cause the joint to become tense, and it becomes very difficult for you to perform your normal day-to-day activities of living. There are reasons where you might not have any injury, but still there are instances where you start gradually developing pain over a period of time. It could be related to arthritis, maybe rheumatoid, maybe seronegative arthritis. There are other kind of arthritis also apart from rheumatoid, which can lead to hip joint stiffness problem. Especially people will feel kind of a stiffness in the joint whenever they get up early in the morning from the bed. They find it difficult to walk immediately after getting up from sitting posture or getting up from the bed. So this could be a kind of an inflammatory problem which can arise in the joint. The other problem which usually we see is nowadays is very common post-COVID is the avascular necrosis, we call, where the joint blood supply is being affected. The joint is getting degenerated because of the necrotic changes which are happening in the bone itself. So this also needs an urgent intervention. It needs to be evaluated. So it's always better to get a physical evaluation done with your orthopedician. So they do conduct some kind of basic test in the joint. After doing these kind of tests in the joint, probably will be in a position to decide what is the basic underlying problem. And just by getting a simple X-ray, most of the things will be very clear and obvious. If you are experiencing any kind of these kind of issues, it's better you get an evaluated done with your orthopedician available. Thank you.